My ethnography research project focused on public health nurses and patient bias. Regardless of one's gender, ethnicity, sexual orientation, age, or morals, everyone needs healthcare. The job of a healthcare provider is not to compare their own beliefs to those of a patient, but to focus on caring and educating. We as humans naturally and regularly use our beliefs as assumptions and make inferences based on those assumptions. Can these assumptions affect healthcare? First, we will look at unconscious biases. Unconscious biases are social stereotypes about certain groups of people that individuals form outside their own conscious awareness. We will be focusing on certain biases seen within the STI unit, the importance of combating these biases and building a patient report, and the disparities between certain groups when being treated medically. We will then analyze the effects of these issues regarding public health nurses in the STI unit. If a client feels offended by their healthcare provider, they may refuse care or not return for additional treatment. All three of my interviewees are registered nurses working in the same public health department located in southeastern Michigan. They all specialize in the testing, treatment, and educating of sexually transmitted diseases. At the health department, the nurses see hundreds of clients a week in the STI unit. As you can see, STDs affect millions of people across the nation, all of which need health care. The majority of people who are seen in the STI unit are uneducated. This is where bias can come in. Nurses and patients alike may feel uncomfortable discussing the topic of sex due to differences in beliefs or attitudes. Nurse 1 was interviewed over the phone while at her home on November 6, 2017. She continues to work at the health department, going on her 8th year. Nurse 1 believes in a monogamous relationship, and the majority of the clients that she sees for STIs do not have the same belief. She says, "After doing this job for so long, I can't be judgmental because I disagree with 90% of the behaviors I hear." Although she recognizes her biases, she does not let them affect her job, but includes that when she first started working in the STI unit, biases affected her more because she was not used to seeing patients with such different beliefs than her own. The majority of the clients these nurses see are gay males and people with polygamous relationships or multiple partners. When the nurses were interviewed for their jobs at the health department, they were all asked how they would feel about taking care of transgender, homosexuals, and prostitutes. One of my sources showed that the groups that are statistically seen as receiving inadequate or unequal medical treatment are also the groups that are seen throughout history being discriminated against. By asking the nurses these questions during the interview process, the department aims at minimizing these disparities. Nurse 2 was also interviewed over the phone while at her home. Nurse 2 is a public health nurse 3, an advanced level lead position in which professionals at this level provide substantial assistance with planning, development, and evaluation of services in major public health programs. She continues her 19 years of working at the health department in southeastern Michigan. Nurse 2 said some of the common stereotypes in the health department are that gay men have multiple partners or that African Americans are more promiscuous.
The body of evidence is very, very deep, that a lot of what we do is based on very rapid unconscious processes, and that we respond to people very, very quickly without even knowing it based on years and years of exposure to ideas. So we store ideas together. Let's say a physician walks into the room and the patient is black, right? And this is a physician who is great, genuinely, consciously unbiased, wants to provide the best care, has very high levels of unconscious racial bias, as do 80% of white Americans. So our physician, our hero, walks in, sees the patient, gets interrupted twice, is worried about another patient, is tired. What happens then is what we all do, is we rely on stored information about the person. We're like, okay, this is what I know about black people. Right? This isn't conscious. Less likely to comply, right? these are the stereotypes, it's not true, less intelligent. Without even thinking about it, our hero sits down with good intentions and is already seeing this patient through this framework, the lens, because the unconscious processes are trying to be efficient, like quick, 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 you know? What do we know about Black people? Quick, quick, quick. Maybe eye contact or body language reflects this, right? And now the patient is, a little hesitant, and maybe that hesitation is interpreted in a way that's consistent with the stereotype. We finally got NIH funding to recruit a very large stratified random sample of medical students from 49 schools. In that study, we were actually just looking at the medical school and student factors that affected bias among graduating and new physicians. We have another study right now in the field in which we're trying to prevent any detrimental effects of the experience of race in white medical schools for Black medical students. I believe that healthcare systems are out in front in saying, we're not ignoring this. We know that our intentions are extremely strongly egalitarian. It's part of our principles, but we also know that there's this huge body of work that says, maybe sometimes we're not even aware of this. Well, we're going to make sure that we do know.
When a nurse sees a patient's chart that says the client is male, 30, and lives in Ferndale, they assume he is gay. This is both a generally true statement and a personal bias. Nurse 3, as the other two nurses, was interviewed over the phone. Nurse 3 is the youngest of the interviewees with the least amount of work experience of 18 months at the health department. It is well documented that STI counseling in primary care is rarely performed and often inadequate. In a recent study, language and comprehension problems were a major barrier for 74.2% of respondents in regards to discussing sexual health. In the health department, there is a translator available in order to prevent misunderstandings between patients and their healthcare provider. Issues between patients and providers in the STI section of healthcare depends on the practitioner. It is important to note that secondary research looked at the views of general practitioners and psychologists, as no research specified on public health nurses who specialize in sexually transmitted infection, testing, and treatment. A hypothetical generalization can be made from the research that although everyone has their own biases, public health nurses are less likely to let their biases affect their work than general practitioners who have less experience in STI healthcare.